Well, the American Cancer Society recently published new guidelines on ways to lower your cancer risk. Dr. Thiru Lakshman, a colorectal surgeon at St. David's North Austin Medical Center, is joining us now. Good morning to you, doctor.
Good morning, Ashley.
Tell us, what are some of these new guidelines?
Yeah, so this is very important, and I think it's quite timely that this information is coming out now. This is based on a lot of recent research that's been going on, and it's essentially looking at the current recommendations for both exercise and diet as it pertains to lowering our cancer risk. And where the changes are now is specifically in terms of exercise. They've adjusted the recommendations, now recommending 75 to 150 minutes per week of moderate exercise, or 150 of strenuous exercise, and then 150 to 300 minutes per week of moderate exercise. So generally, if you can get something in every day, that would be ideal. From a diet standpoint, what they're recommending is more of an emphasis on whole foods and a wide spectrum of nutritious foods versus focusing on specific nutrients. Eating a good balanced diet with whole fibers, lots of fruits and vegetables, particularly brightly colored vegetables and fruits, and trying as best as possible to avoid red meat, either completely or in minimal amounts. And then finally is an emphasis again on decreasing alcohol use. Ideally, we prefer, the guidelines prefer no alcohol at all, but if there is to be alcohol use, they recommend one drink per day for females and no more than 2 drinks per day for males.
So, some of those recommendations, particularly when we're talking about working out more, having more activity, that has been a challenge for a lot of people during this pandemic, right?
Absolutely, yeah. I mean, I think people jokingly refer to it as the COVID-19, right? And it makes it very difficult to get out there with gyms being closed and working from home and how it's affected childcare. All of those things clearly can affect that. But in some ways, it puts that much more emphasis on why we have to focus on it, because our health is already suffering because of the pandemic, and due to the mental factors and the physical constraints of the pandemic, it's limiting our exercise and also limiting our dietary choices. I think the goal here is personal responsibility. As Americans, we need to look at making small, short-term changes to affect long-term outcomes. Just a little bit of exercise every day, changing a few of your dietary habits, trying to minimize alcohol, obviously cutting out smoking. All of those things are things that can happen even within the setting of a serious pandemic like this, and will improve our overall health as a society. I mean, the study, the ACS showed that of those people who had a sedentary lifestyle, meaning little to no exercise, they had an 82% increased risk a lifetime of getting cancer.
Wow. Wow, that is a significant increase, wouldn't you say?
Yes, absolutely. It's very concerning. And, in addition to that,
Wow.
The additional piece to this is making sure not just that we're exercising appropriately and trying to get the best diet as we can, understanding the constraints of the pandemic, but also making sure that we take care of our routine health care and our routine screenings for cancer as well, too, which is going to become a significant issue in the midst of this pandemic also.
Absolutely. Well, Doctor, we thank you so much for joining us today with this important information. Again, folks, got to get out, got to get some physical activity, because, gosh, that 82%, that is significant. If any of you missed this interview, we're going to upload it onto KVUE.com for you right after the newscast. We'll be right back.